So now for the fat-soluble vitamins, A, D, E, and K. I call them a deck to remember them. They are more likely to become toxic because they can't be excreted in the urine. So the body can store them, okay, in fat tissue and liver especially. So deficiencies tend to develop pretty slowly. They can be toxic at 6 to 10 times the RDA, so you do have to be a lot more careful about excess intake from supplements of the fat-soluble vitamins compared to water-soluble vitamins. So first we'll talk about vitamin A. It comes in two forms: preformed vitamin A, which is found in animal products, and the precursor to vitamin A, provitamin A, which is beta-carotene. Preformed vitamin A, there's three basic types: retinol, and retinoic acid. You might have heard of retinoic acid. That is in Retin A, which is sometimes used to treat acne. So like I said, it's from animal sources. It can become toxic. If anyone ever offers you polar bear liver, refuse it, because polar bear liver has so much vitamin A in it that it can be lethally toxic in relatively small amounts. But liver in general is one of the best sources of vitamin A, preformed vitamin A. And in other animals, the types of liver that humans eat, it won't become toxic unless you eat very large amounts every single day. In large amounts, it can cause terrible birth defects. So pregnant women need to ensure that they don't consume too much. The acne drug Accutane is a high-dose vitamin A derivative, and if you go on that, it's for severe cystic acne. If you go on that, you're supposed to be, if you're a female, you're supposed to be on birth control because the birth defects are so severe. Beta-carotene, the precursor, is found in, bright orange and yellow vegetables, and it does not become toxic. Because what happens is if the levels of beta-carotene build up really high, the body will just stop converting it to vitamin A. Functions of vitamin A: it's important for eyesight, growth and development, skin health, the health of other linings of the body, epithelial linings like the lining of your mouth and digestive tract, for example, and it's important for immune system function. The people at risk for deficiency, the deficiency of vitamin A is actually common in third world countries. Children with poor vegetable intake, people in urban areas with poor food intake, the elderly who don't eat a lot of vegetables or meat, alcoholics and people with liver disease, individuals with malabsorption syndromes. So night blindness is one of the symptoms of vitamin A deficiency, where you have trouble adjusting from light to dark vision, because vitamin A is required for that. Now, I can tell you, as you get older, your capacity to adjust to from light to dark diminishes with age, not just from vitamin A deficiency. It's harder to see at dusk. In other words, when you have trouble transitioning from light to dark vision. This is reversible with adequate vitamin A intake. If you have that difficulty that comes with age from seeing it at dusk or adjusting from light to dark, excess vitamin A will not help that. That's just part of aging. Xerophthalmia is a condition that can occur with severe vitamin A deficiency, and that what occurs with that is that the eye loses the ability to produce mucus. So the eye becomes really dry. Dirt particles or dust can scratch the surface of the eye, leading to scar tissue. It can lead to infections and permanent blindness. So here's a picture of somebody who is blind. You can see the scar tissue build up because of severe prolonged vitamin A deficiency, which could have been completely prevented with vitamin A supplements. So toxicity of vitamin A, the preformed vitamin A in animal foods or from supplements of preformed vitamin A can become toxic. Beta carotene, the precursor to vitamin A, will not become toxic. Now, people who consume a ton of beta carotene can become orange. It's an orange pigment. So it can turn the skin orange. In fact, those were the first tanning pills. I had a patient at the hospital who juiced 10 pounds of carrots a day and drank that, and he was actually bright orange. Toxicity, the big concern is birth defects. Pregnant women, there is an upper limit of vitamin A for pregnant women. The preformed vitamin A to prevent birth defects. Excess vitamin A, like I said before, stunted growth, hair loss, liver damage, and it can cause death. Okay, vitamin D, sometimes called the sunshine vitamin. It is derived from cholesterol, you know, that molecule with the per-hydroxychlopentanophrananthen ring structure. It's made from the body when ultraviolet rays are exposed to the skin. The cholesterol that's in the skin starts the process of turning into vitamin D. You can get enough vitamin D from sun exposure if you expose a significant amount of your skin at peak sun hours if you expose, a significant amount of sun to, a specific amount of skin to the sun at the peak sun hours between like 10 and 2. Now, people with light skin are better at making vitamin D, so people with darker skin need more sun exposure than that. Also, if it's cloudy out, if there's a lot of pollution, less UV rays will be available to make the vitamin D. Less is made in the winter and northern latitudes, so people who live in northern latitudes are actually at increased risk for deficiency of vitamin D. Now, a word about using the sun for your vitamin D. Most health professionals caution against sun exposure because of the risk for skin cancer, and having lived in Colorado, knowing the number of people I had to take to get skin cancers removed, I myself avoid the sun and use vitamin D supplements. Older people with older skin doesn't make vitamin D very well either. This is just a picture of kids in Russia, very northern latitude Russia, where they got their vitamin D from being exposed to sun lamps at school. So the adequate intake for vitamin D, there isn't an RDA. They did increase it several years ago. It's about 600 international units for adults, 800 for older adults. Some people think that that's not enough. It should be more like 1,000 to 2,000 international units a day. So the functions of vitamin D, immunity, people are talking about it now with COVID. It's important to be getting adequate vitamin D for optimal function of the immune system. It may be protective against type 2 diabetes, cancers, depression, cardiovascular disease, multiple sclerosis, dementia, and it's actually really important for bone health. We used to just talk about vitamin D and bone health, and then they found out it was important for all these other things as well. The incidence or prevalence of multiple sclerosis is actually higher in northern latitudes, and I think one of the reasons is less exposure to the sun and less vitamin D. Vitamin D is important for maintaining normal blood calcium levels. It increases calcium absorption, decreases excretion of calcium. So the deficiencies, osteomalacia, which is demineralization of bone. Osteo refers to bone. So the bones break easily when they're demineralized with calcium. Rickets in children. can result from a vitamin D deficiency because they don't absorb enough calcium, okay, which causes their bones to soften and bend. And then, like I said before, vitamin D has some other functions, or it's linked to some other conditions as well. Here's a picture of a child with rickets. You can see the bones of the legs are bowed because they're soft and weight bearing, and when the child starts to walk, the bones tend to bow. Okay. So people who are not exposed to sun and people who don't drink vitamin D fortified milk or take a supplement are at increased risk for vitamin D. And I'm not going to show, well, I'll show you the video, and then I'll stop with vitamin D and finish the rest because this video is getting kind of long. Let's see.
Perdona.
Excuse me.
Yes.
¿Puedes decir cómo llegar al centro?
Chantel Cornelius makes sure her son gets plenty of milk every day.
He takes about, I say, 5 bottles, about 6 ounces each.
But when it comes to vitamin D, he still may not be getting enough. The American Academy of Pediatrics has now doubled the recommended daily intake of vitamin D for infants and children to prevent rickets and other diseases that weaken bones.
A baby may not be able to walk or have bow legs, weak bones, higher chance of developing and having a fracture from this.
In addition to strengthening bones, evidence also suggests vitamin D could reduce the risk of cancer, diabetes, and even heart disease. Doctors say more children are suffering from a vitamin D deficiency, partly because they spend less time in the sun.
Because of the cancer scare, a lot of parents are not taking their kids out for any exposure to sunlight at all.
Besides sunlight, milk is the most common source of vitamin D, but most kids don't drink the required 4 to 6 cups every day. That means millions of children will need to take vitamin D supplements, which also come in chewable tablets and drops for younger children. For infants, baby formula is fortified with vitamin D, but pediatricians recommend breastfeeding for at least a year.
A mother actually has to drink a lot of milk to be able to give enough vitamin D in her breast milk.
Another good source of vitamin D for children, eating fish. But parents know that could be an even harder pill to swallow. Dr. Malika Marshall, CBS News, Boston.
Okay, on that video, they said 4 to 6 cups of milk a day for children. That's a lot, more than many recommend. The vitamin D supplements are becoming more highly recommended, and I do take a supplement of vitamin D because it's hard to get in the diet, and a lot of people can't tolerate milk either, so that's another reason that more people are supplementing. And most health professionals think that the risk of cancer that it's not worth trying to get sun exposure for vitamin D because of the risk for skin cancer. I've worked in cancer units where people have had to have their nose and a lot of their face removed because of skin cancer. In fact, I worked with a professor in Colorado, who had to have his upper eyelid, some of his lower eyelid, and most of his temple and part of his cheek removed because of skin cancer from sun exposure. They did plastic surgery and, did a really good job, but because his eyelid was not made of normal eyelid, it didn't have, it was kind of dry, his cornea is being scratched and he may lose the vision in the eye. So from what I've seen, I had another faculty member who had a finger removed because of melanoma. What I saw in Colorado, for me, it's not worth taking a chance, and I get my vitamin D because I'm at high risk for skin cancer, I get it from a supplement. Toxicity of vitamin D is actually a concern. Can cause increased blood calcium, which can cause some problems with muscle action and nerves. Slowed growth, narrowing of the arteries. Sources of vitamin D. foods just aren't very rich in vitamin D. Fortified milk is the greatest source, and you know, it's fun for me to see that butter's a really good source, but that's not a real good reason to start eating more butter. Some cereals are fortified with vitamin D. There's some other foods that are high in vitamin D, but it is hard to get enough from foods. So supplements are typically recommended. What you want to, you know, I look for about 1,000 international units of vitamin D. Vitamin D3 is the active form of vitamin D, but it's obtained from sheep's wool. So some vegans do not want to consume vitamin D3 supplements. So they take vitamin D2 supplements, which can be activated to vitamin D3 in the body. So I'm going to end now because that video got kind of long.